I'm going to be demonstrating range of motion. Range of motion is provided to patients to keep their joints mobile and moving, so be sure to check the patient's plan of care for any contraindications. It's best to move in a head-to-toe fashion using smooth but firm motions and observe the patient to make sure that they don't have any indications that they may be in discomfort. For this demonstration, I'm going to be working in a head-to-toe fashion just on this one side of the body using 3 repetitions. But for real patient care, it's recommended that you do 5 repetitions on both the left and the right side using your principles of safety and infection control. Good morning, Mr. MacGyver.
Good morning.
I'm your nurse Tammy, and I'm going to be performing range of motion exercises. If at any time you have any discomfort, please let me know, okay?
Okay.
We're going to get started with the top of your body, your neck, and we're going to work all the way down to your toes.
Sounds good.
Just for your neck, I'm going to remove your pillow so that we can perform it properly. Flexion, extension, flexion, extension, flexion, extension. Lateral flexion, lateral flexion, lateral flexion, lateral flexion, lateral flexion, lateral flexion, lateral rotation, lateral rotation, lateral rotation, lateral rotation, lateral rotation, lateral rotation. I'm going to give you your pillow back, make you more comfortable, and then we're going to move down to your shoulder. Flexion, extension, flexion, extension, flexion, extension. Now I'm going to support your elbow here. Abduction, adduction, abduction, adduction, abduction, adduction. External rotation, internal rotation, external rotation, internal rotation, external rotation, internal rotation. Now I'm going to do your elbow. Flexion, extension, flexion, extension, flexion, extension. Doing okay?
Mm-hmm.
Okay. Now your forearm. Supination, pronation. Supination, like you're holding a cup of soup. Pronation, supination, pronation. Now your wrist. Flexion, extension, hyperextension, flexion, extension, hyperextension, flexion, extension, hyperextension, radioflexion, ulnar flexion, radioflexion, ulnar flexion, radioflexion, ulnar flexion. Now your fingers. Flexion, extension, hyperextension, flexion, extension, hyperextension, flexion, extension, hyperextension. Now we're going to move the fingers apart and together. Abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. And when you're at home, you could always do it like this, make it a little easier. Abduction, adduction. Now I'm going to do your thumb. Flexion, extension, flexion, extension, flexion, extension. Adduction, abduction, abduction, adduction, abduction, adduction. Opposition, 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 position, opposition, opposition. One more. Opposition, 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 opposition. Good. We're done with the top half of your body. Now I'm going to come to your hip and your knee. Flexion, extension, flexion, extension, flexion, extension. Abduction, adduction, abduction, adduction, abduction, adduction. Internal rotation, external rotation, internal rotation, external rotation, internal rotation, external rotation. Doing okay? Okay. Now I'm going to come down to your ankle. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. Inversion, eversion. Inversion, eversion. Inversion, eversion. I'm going to do your toes. Keep them moving. Flexion, extension. Flexion, extension. Flexion, extension. Abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. So we're going to do that 3 times. And one more. Abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. Okay, we've done all the maneuvers lying on your back. Now I'm going to have you roll over to your side for me so that we can do the rest of your joints. If you could roll to that side, please. Great. So I'm going to start with your neck. Hyperextension, extension. Hyperextension, extension. Hyperextension, extension. Okay, you can relax. Now your shoulder. Hyperextension, extension. Hyperextension, extension. Hyperextension, extension. And then I'm going to make your arm go in circles. Circumduction, circumduction, circumduction. Okay, now I'm going to have you hold on so I can finish up with your hip. Hyperextension, extension. Hyperextension, extension. Hyperextension, extension, and circumduction. Circumduction, circumduction. There we go. Okay, I'm going to have you roll over back to your back. Are you comfortable?
Yes.
Okay, if there's anything that you need, let us know. I'll be back to check on you. And that completes our range of motion for this morning.